Welcome to the Friday Focus. My name is Dr. O from ENS Orthodontics, and I hope you had a great 4th of July weekend. And we are now in the process of talking about this issue of cosmetic dentistry versus orthodontic treatment. And so last week we talked about a situation where I had a patient come in who needed to have orthodontics done first in order to have her teeth, one of her crowns, look like the other front tooth. And so what we did is we did a technique where we actually we use braces to match up the gums. And so this week what we're going to do is I'm going to talk about a different scenario, which is kind of similar, but a different outcome, okay? And so we have this person, this is how they came in, and what was really interesting was her dentist gave her the option of doing cosmetic veneers from canine to canine. And so one of the things that when she came into our office, and the idea is that he was going to do a veneer on this tooth because of the discoloration. This tooth was set back, and so what he was going to do is put a veneer or like a crown and just kind of push it forward. So from this side to this side, she was going to have veneers done. And she told me, she was like, he called it like instant orthodontics. And so one of the things that I showed with her, and we sort of talked it through, was she didn't want to have she didn't want all that crown work done or all the veneer work done. And she wanted to try to keep her natural teeth. So I said to her, like, that would be a perfect opportunity. You can get a great smile if we do orthodontics. And so we did brace, so we ended up doing braces, and this is the outcome of treatment after about 14 months. And you can see the perfectly straight teeth. So really she really didn't need veneers, okay? But it was really interesting. I got to this point, and relating back to last week's issue, you can see that there's a difference between the gum heights, where the tooth and the gum meet on this side versus this side. And I told and I shared with you last time, okay, that when we want to have symmetry across the gum heights, across this area, I said, well, you can actually move a tooth up and down. And so the question is like, why didn't I do that here? And so the reason I didn't do that here is because she wanted to keep her natural teeth. So if I would have moved these up to match this side, then I would have forced her to get veneers on at least 2 of the teeth. And so as a option, what we decided to do instead was there's a procedure that can be done. It's called crown lengthening. And so what we did is we used a little laser and we actually cut away some of this extra gum tissue so that this tooth and this tooth were more even. And as a result, we also did it from here to here. And as you can see, we transformed the smile from here to here using a combination of braces and what we call a gingivectomy or gum surgery. So that combination actually worked pretty well for her, because then we were able to address a couple things. One, the crowding even on the bottom and the top. And then one of the aesthetics concerns is that when she smiled, she didn't like this. And so we used a laser to create this symmetry, and then she was really happy with her smile. And so I just am showing you this is because in certain scenarios, cosmetic dentistry isn't the solution, but orthodontics and sometimes even a little gum procedure can make all the difference in the person's smile. Okay, so hopefully this was an enlightening. If you have anyone if you have this situation, or, please talk to us, and we can kind of work and determine what the best solution is for you to give you a great smile. Again, with us, we're trying to create wide smiles without extractions. As you can see, no extractions. And I hope you have a great week and a great weekend and a great next week. We'll see you next time with the next Friday Focus.